Hi, my name is Shawnie. We talked a little bit on the phone. Um, Today we are going to just go over some information that you provided on the phone and do a biopsychosocial assessment. This just helps me gather some information about you and kind of what's going on right now to help us kind of create a treatment plan that we both can agree to. But first and foremost, thank you for coming in.
Yeah, thank you, Shawnie.
Is it okay if we go on with the assessment?
Absolutely.
Okay, so I'm just going to gather some basic information at first. If you need me to stop or need a break, please do not hesitate to let me know and we can take a break. It's a lot of questions. Just answer them. There's no right or wrong answers. The best of your ability. Okay?
Thank you.
First, is your name pronounced Jamie?
Yes.
Great. What's your date of birth?
February 3rd, 1992.
Um, what's your preferred language?
English, please.
Awesome. What are your preferred pronouns?
She, her, hers.
Awesome. So that was just some of the basic information that you provided on the phone. I just wanted to double check. What kind of brings you in today?
I just have a lot of anxiety. It's just nonstop. I feel like I can't think straight a lot of times, between life and school and work, and it's just been overwhelming. A little too much to handle on my own.
That can be a lot. It sounds like you're juggling a lot of tasks and it's creating some anxiety for you. How
Absolutely.
long have you been experiencing this?
Um, Been experiencing it or noticing it? I'd say the last several, I don't know, maybe even since I've been in high school, but I think I'm noticing it now. In high school, I used to, even out of high school, I would run into an issue and I would just run from it. I never dealt with it. I think now, as an adult in my 30s, I can't just run from everything. And so I think that's where the really big buildup is. And because I never dealt with those issues as a child, now it's coming back to make my anxiety that much worse.
It sounds like you've been kind of always dealing with these symptoms, even when you were in high school,
Mm,
and now it's carried over to your adult life. On a
absolutely.
typical day, like on a scale of 1 to 5, how would you say like these symptoms affect you? From one being mild to five being more severe.
I'd say a 4.
It can be a lot for you have all these tasks that you have to do,
Yeah,
and it seems like it creates a little bit of anxiety for you to get all of that done.
yeah, it does.
Coming into therapy, what are some of your goals and expectations if treatment were to be successful?
Yeah, I would say more self-care strategies, coping strategies, ways to deal with the anxiety when the situations arise instead of running from them.
Well, it seems like you're fully aware of like what you need, but might be having a little trouble of like implementing them into your day-to-day activities.
Yeah,
In our next sessions and things like that, we can like with this information from the assessment can come up with a great plan to implement those things that you're looking for.
certainly.
Are you doing okay? Do you need a break or anything?
Okay.
Awesome. So in our next kind of section, it's gonna ask about symptoms and things that you've been experiencing in the past 30 days. I'd like you to really kind of focus on the past 30 days and what you're feeling. when I'm asking if you're experiencing any of these symptoms, don't feel free to elaborate if you would like. They're just some kind of basic things. Is that okay to go along?
Yeah, thank you.
Okay. In the past 30 days, have you experienced sadness?
Yeah. Yeah, I think yeah.
Would you like to talk a little bit more about that?
Yeah, it's just kind of I set too high of expectations for myself, and if something doesn't work out, even if it's realistic or not, I feel like I've let myself down.
And that can be really hard because we set these goals and then when we don't reach them, it's like,
Mm.
it sounds like it kind of feels like a personal failure on your
Yeah,
end.
absolutely.
And have you felt like hopeless or helpless?
No.
How about sleeping? Have you been sleeping too much?
No, I love sleep, but I think I sleep pretty well.
You said you're sleeping pretty well, like, but during the day, like, how's your overall energy? Is it fatigue, no energy?
I would say a lot of times no energy. And I think that also comes from poor like self-care and feeling the need to constantly go, go, go. My
Yeah,
brain,
that's a lot to manage.
my brain doesn't stop.
How about memory? How's your memory? Do you think it's really good or
It's a really great question. No, I don't think it is at all. And I think that's just me with the constant thoughts in my mind, and my mind's never just clear. Um, so I would say my memory's not.
sounds sounds like you got a lot going on in your head and you kind of struggle sometimes with remembering some things.
Exactly.
How's your motivation level? Like, do you enjoy the things you do, like going to work?
You
Is it
know,
easy?
I feel like my motivation level is high if I gain something out of it. Like if I'm very motivated, if I know that I'm going to like, if I'm going to get something out of it. Like I'm not motivated to go to work unless it's being recognized for something good. I'm not motivated to do, I like to see a reward at the end.
It kind of seems like you like that reassurance, like I'm
Yeah.
doing the right thing.
Yeah.
How about your interest in your daily like activities? I know you said you kind of struggle like if you don't have a reward, but like what about the things you do enjoy?
I enjoy going on vacations. I enjoy warm weather, being outside. Um, I like riding horses. But sometimes I feel not motivated to go there until after my horse has been ridden, and then I feel good.
So it kind of sounds like your horse at times can be a little glimpse of that relaxation therapy.
Yeah.
Have you ever had thoughts of like dying?
No.
Okay. What about guilt or feeling worthless?
Um, Guilt, yes. I don't think as far as worthless. I think that also goes back to, feeling like if I start something and I can't finish it, I feel like I've failed. So then I start something else. And then I just keep adding more to my plate, just waiting for that instant gratification.
And it kind of sometimes is like hard to say no
Yeah.
for other things. How about your appetite? Have you been like not hungry?
I love food. So I don't I don't think I've lost any appetite. Maybe I wish I did sometimes, but
How about being alone? Is it something that you like really strive to do, or do you like to be out with people?
I feel more anxiety if I'm alone. So I really thrive in a social setting.
What about like your anger and irritability? Have you noticed like a difference in
Yeah, definitely. I think if something doesn't go my way, I get instantly frustrated and angry. So yeah, I've certainly experienced that lately, and it goes away fairly quick, but it definitely comes up.
well, in a little bit earlier you had said that you sleep well at night, but do you ever like have trouble like falling asleep or you can't sleep?
Um, I usually fall asleep pretty well, but when I don't, it's because my mind it has racing thoughts of things I need to do or things that didn't go wrong or an email I have to send or how is someone going to reply?
Do you at times feel like you have like maybe too much energy?
Yeah.
Just kind of keeps you going and can't stop.
Yeah.
Are there times where you feel like I don't need to sleep. I just need to get things done?
No, I definitely love my sleep.
Do you ever feel like you talk too fast?
Yeah. Yeah. I definitely do. And I don't always think about things I always say sometimes. And yeah, I've said,
Maybe a little bit impulsive.
yeah, absolutely.
That can be a little bit difficult when we're making decisions and like have so much on our plate and we're just like, we want to make a decision.
Yeah, and I don't think about it before I make decisions. So that's probably my anxiety.
Would you say you kind of struggle with concentrating on making a decision, or do you feel like you kind of think it through, but I don't know, you just are like, I just need to get this done.
Yeah, I usually don't think it through. I just agree to things and I'm like, okay, let's do it. And then I get burnt out.
And
So,
then you get a little burnt out.
hmm.
When you say that you're being burnt out, does it ever feel like you get restless when you're trying to relax, or like when you don't get things done?
I think my burnout really comes to like no longer having like empathy for what I'm doing or like compassion. Like I get just very short and just frustrated. And I'm like, why are you emailing me? Like, leave me alone. I have about 20 other people to email. Why are you emailing me right now? So a lot of like short tempered, I guess, outbursts.
So it's kind of more of like emotional restless rather than you can't sit still.
Yeah, I think that's a great way to look at that.
Okay. Have you ever been like suspicious of things or people, hearing things, seeing things?
No.
Okay. Awesome. Thank you.
Yeah.
Answering so far. Have you ever thought of like you have like these special powers?
I sure wish I did, but I think I'd be a lot further in life if I did.
Wouldn't we all? Do you ever feel like people are watching you or out to get you?
No.
No, I know you said at times you feel a little nervous about not getting things done. Is that like a pretty general feeling, like feeling nervous?
Yeah, I think that, I mean, like, I'm not a doctor. I don't really know what the true definition of anxiety is. So I think that the nervousness just comes along with like needing that reassurance and needing that, like, what am I trying to say? Like that constant gratification.
When you're not like, when you aren't able to finish tasks, because I know that you had mentioned that sometimes you take on, you say yes to a lot of things, and then you have so much going on that you have trouble remembering things. Does that ever make you feel like you're panicking because you're not getting the instant gratification.
100%. Yeah. Yeah.
Yeah, it can be kind of hard. Do you think that creates like a little bit of fear, like fearfulness too?
Yeah, because I'm constantly telling people these new things I'm going to do. But then I'm like, why am I going to tell them if I can't even complete it or finish it? And then they're going to judge me. And then I'm letting myself down. And then I feel like I've lied to myself.
Yeah, that can be a lot.
Hmm.
Just taking a second to pause because I noticed that you kind of gotten a little worked up about that. Um, I know earlier you said that you thrive in like social situations, but are there any times like it's hard to be in a crowd, like you just can't do it?
I actually really dislike large crowds. Um, like I hate loud noises. Like I don't know. Like I don't want to like being in a mall will annoy me. Like going to a bar if it's really busy. Like I don't want to be there. But like going out to dinner with friends or going out to dinner with so and so. Like I enjoy being around people. When I am a homebody, I very much love being at home.
It kind of seems like you like to be out with like friends and more quiet social situations rather than around people that you might not really know that are being loud. And
Exactly.
do you say you kind of like in those situations get easily startled?
Very startled and frustrated and very judgmental.
Yeah. So do you feel like you kind of like avoid those situations?
Yeah, I do. I do. And I constantly like I feel like people are like judging me or like what do they think about me? And no one's probably even looking at me, but maybe that's my own like self-esteem. I don't know.
You say that you kind of have those feelings when you're in a social situation, like out. Do you kind of carry that over into like your work life as well?
Yeah, 100%. Yeah. That's why I think if I don't like hear from my boss, I get anxiety. Like that should be a good thing, right? Like if I haven't heard from her, I'm not doing anything wrong. But because I am a social person and I have those fears of failing, my fear is always, well, if I haven't heard from her, maybe I'm doing something wrong and she's preparing to have a meeting with me.
Yeah, and that can be kind of scary, and you're like, oh no, what did I do wrong?
Yeah,
Do you ever have like reoccurring nightmares?
all the time. And they're all like work situations or school situations, like not being able to get into my locker, like back when I was in like third grade, or back when I used to be a waitress, like not being able to get to the table. I
It's
don't know if
kind of like if
they're
you,
nightmares, but like, yeah, they're all the time.
it kind of seems like they stem from that anxiety of not completing tasks or
Yeah.
not getting things done.
Mm-hmm.
Have any of these feelings ever made you contemplate suicide?
No.
Are you a survivor of trauma? Like, have you had trauma in your childhood or now?
Mm, I mean, I feel like everything in our life is trauma, but nothing like physically, maybe emotionally. Both of my parents have been married and divorced a couple times. So I think that fear of maybe abandonment, I don't know, and not being
Feeling,
enough.
yeah, it seems like that might kind of struggle with your anxiety, like of not being enough, and might
Yeah.
have stemmed from there a little bit.
Hmm.
Are you pregnant or ever been pregnant?
No.
This next question can be a little intrusive, so feel free to answer um or not answer. Are you at risk of HIV, AIDS, or any sexually transmitted diseases?
Not that I'm aware of, and I've been tested, so
Okay. Do you have any allergies to foods or medication?
um, no, not that I can think of. Just really allergic when a mosquito bites me. But
Yeah, sometimes those little buggers can get you.
yeah.
Has your physical health kept you from like doing any of your daily activities, participating in anything that you wish you could have?
Not at all. I'm pretty lazy, but not keeping me from what I want to do.
Okay. Just gonna take a second to kind of just breathe. And we're done with this section now. And in our next section, we're going to talk about tobacco. But I just kind of wanted to take a pause
Okay.
and give you a second to just kind of take a deep breath. It's a lot of questions.
Thank you.
Is it okay if I continue?
Yes, thank you.
The next section, like I said, is going to be about tobacco and just like smoking. Have you ever used any forms of tobacco, such as cigarettes, chewing tobacco?
No.
So in our next section, this is going to kind of talk about like substances and like addiction. Just answer them with the best of your ability. There's no judgment and this is all very confidential, this whole assessment. Um, so please feel free to answer as much as you would like. Would you or someone you say have a problem with alcohol? Someone say that you have a problem with alcohol? Sorry.
I do use like wine as my way to like de-stress, I guess, after a long day of work. I love red wine, so
How many times or glasses, should I say, do you drink, let's say, per day or per week?
I'd say maybe like 3 glasses of wine, like sometimes like 7 days a week.
Okay. Would you say anybody says or you think that you have a problem with like other addictions such as pills,
No, never.
illegal drugs, gambling, even shopping? Sometimes that can be a stress reliever.
Yeah, no, just the alcohol.
Okay. Have you ever been to maybe like a self-help group?
No, because like I don't know that I think it's a problem. Like if I can still like function after a couple glasses of wine and that makes me sleep, like I don't know why everyone else has to worry about me if it's not their health.
Yeah, it can be frustrating when everybody's worried about you and you're trying to like do all these other things, worrying about other people.
Yeah.
Our next section is going to kind of talk about your past with substance abuse and addiction. Would yeah, I know you said that you kind of drink alcohol now, 3 glasses of wine. Um, would you say that's always been a problem? I wouldn't say a problem because
Yeah,
like you said,
I've always very much used it like recreationally. So I started drinking probably, I don't know, when I was like 16, like everyone else does. And I think in high school I got worse. And then I don't know, I think maybe it stayed pretty steady.
in the past, I know you said you currently aren't using any pills or illegal drugs. Have you in the past?
No,
Have you had any other addictions in the past, such as having a problem with shopping, finances,
no,
gambling?
no.
Awesome. Thank you for answering those
Uh,
questions. Switch gears now. a little bit more, hopefully less intense about asking more intrusive questions. This is going to be more about your family and just kind of like how your support systems are. Is that okay to continue? You need
Yes.
a break or anything?
No, I'm okay. Thank you.
Who do you currently live with and is in your family?
I live with my boyfriend. Um, we live out of state from my family, so my boss, who's also, I guess, like one of my best friends, I consider her family my family, which I guess would be like extended. But yeah, I'm really close with my mom and my grandma, two grandmothers.
That's awesome to have like some of those people that you can talk to.
Yeah.
Has anybody left your life in the last 90 days that's been significant, like a family member or close friend?
Yeah,
I know you said you had,
I really push people away. So like I don't really like have friends. Like I consider friends like my social life at work, which aren't really friends. So
kind of like work friends.
yeah.
How is your relationship with your family? Would you say it's good, fair, poor, close, kind of stressful, distant,
Distant.
distant? How about, I know you said your boss is like your best friend and she seems like a big support system. How do you feel like those relationships are? Do you
Um,
feel like they're good?
I would say excellent. We keep work and relationship separate.
Do you have any problems that are like going on in your family now?
No,
Have there been any like conflicts in the past? I know that you said you're only close to like your mom and your two grandmas.
yeah, my dad, he was an alcoholic growing up my whole life. And so I just like we don't talk at all. He's just disappointed me like way too many times. And so I've kind of like cut him off.
Yeah, that can be hard when he's supposed to be your support.
Yeah.
And I know that you said that you're living with your boyfriend. Have you ever, though, been married?
No,
Have you been having problems like with your relationship because of your symptoms?
no, he's really supportive. And
That's really awesome.
uh,
I know that you said that you didn't have any like close friends, but do you get along with others pretty well, like your neighbors? I know you said that your boss is like your best friend.
yeah, I get along with people if they agree with things like I'm doing. And if somebody challenges me, like I kind of,
Oh, it's kind of like I don't have time for this.
yeah.
So you said that you get along with people as long as they're doing things. So you'd say like you get along with your coworkers pretty much, but maybe not so much your neighbors if they're not doing exactly what you're doing.
Yeah, it's more like I get along with people. I just like I think that's why I've lost some friends is because like if they try to challenge me in like my thinking or decisions, I get really defensive.
Okay. What's things that you like to do for fun to kind of help you relax?
I love being outside and going camping, and I really love anything like in the summertime.
Camping can be very relaxing.
Yeah.
Okay, we're done with our personal and like family relationship section, and we're gonna move on to education. Um, as I said, answer these as much as you can and with much information as you want. If you need to take a break, again, please don't hesitate to ask. I know this is a lot of questions and can be kind of time consuming and a lot coming at you at one time. Is it okay if we continue with the education section?
Yes.
What's your highest education completed?
Bachelor's and currently in a master's.
That's really awesome. How has that been going for you? How would you describe your experience?
Stressful. Very
A
stressful.
lot of work.
Yeah.
But it seems like you have a lot to juggle at work, and then you have school,
Yeah.
and you're currently in school in a training program. What is your degree kind of focused on?
Mental health. Yeah.
So
What I need to practice.
it's kind of like a personal and professional thing for you. Okay. Next we're gonna move on to legal. Have you ever been arrested?
No.
Right. Well, that shortens our questions in that section very a lot. So we're gonna move on to employment. What does your work history look like?
I've
Is
had
it good?
good work history, yeah.
What kind of jobs have you had?
A lot of like babysitting and nannying, restaurant jobs. Um,
Jobs that deal with a lot of people and like being around them. How long would you say that you normally keep a job?
Usually a couple years.
Good amount of time. Have you ever served in the military or retired from a job?
No.
Mhm. Our next section is going to kind of talk about our medical, and it's our final section. So we're almost to the end. But if you need a break, please do not hesitate to stop me. Um, okay, so do you have a current primary care provider?
I don't. I need to find one. It's been on the back of my list.
Kind of, is that something that you would like some help with? Like maybe I could look some things up and we could talk about it in
Like,
our next meeting.
yeah, like I know who I can go to. I think it's just like with my busy mind and so much on my plate, I'm like, my health is fine. I don't need one right now. So,
Okay. Have you had any past or current medical or surgical problems?
no.
Have you ever sought mental health services before? Like
Um,
seeked out
I've seen like therapists in my life just for kind of general need someone to talk to, but
therapists? When and kind of like what was your reasoning for seeing them?
I think just like I don't know, I was seeking more like life coaching advice.
So it's been kind of like more in your adulthood, or have you
Yeah.
seen a therapist in your
Yeah, it was my
childhood?
adulthood like last year.
Okay.
Just feeling like overwhelmed and just needed some guidance.
Are you currently seeing a psychiatrist?
No.
So that's all the questions that I have for you. Is there anything that you want me to know about you?
Yeah, I think that's all. It's just knowing like I go 1,000 miles an hour. Just needing some support and finding ways to like cope with the feeling of being let down and constantly needing to pick stuff up. But other than that, I don't think so.
Seems like you have like a lot going on, and I'm really thankful that you've taken time out of your day to even come and see me today. It takes a lot of courage to come in and help, like find help to like seek some of these answers of how you can make things a little bit easier. So I just really want to let you know that I'm very thankful for you coming in. And as I write up this assignment or assessment, assignment kind of thinking in go mode, I will in our next meeting have that all done and we can kind of go over it and hopefully set up a plan of how we can kind of continue these sessions and how we can help create those coping skills and tools into your daily life.
I think that sounds
Would you
great.
be okay with that?
I think that sounds great. I appreciate it, Shawnie.
Thanks for coming in today.
Absolutely. Thank you for everything. Great.
Thanks.
Bye.